Grief doesn't have stages. It has cycles. Here's my story. People talk about the 5 stages of grief like you go through them one at a time and then you're done. That's not how it works. Grief isn't linear. The 5 stages are denial, refusing to accept the loss, anger, rage at the unfairness, bargaining, trying to undo what happened, depression, the deep sadness when reality hits, and acceptance, coming to terms with the loss. But here's the thing, you might go through these in any order. You might skip some. You might cycle through them multiple times. There's no timeline. There's no right way to grieve.
Most people grieve, and over time, the pain gets easier. But sometimes, grief gets stuck. That's called complicated grief syndrome. It's when the loss is so overwhelming that your brain can't process it. You can't accept the person is gone. Life feels meaningless. Years pass, and the intense grief doesn't get better. It just stays. I had complicated grief syndrome for years after losing my best friend. My condition became even more complicated. I also have schizoaffective disorder. So while I was grieving, my brain was also dealing with psychosis and delusions. I was trying to process the loss while my mind was creating false realities. I thought I could resurrect him. I thought his soul was with me. I was cycling through the 5 stages of grief while also experiencing untreated psychosis.
That's what complicated grief syndrome looks like when mental illnesses are involved. It's not just sadness, it's chaos. It's your brain trying to handle grief and psychosis at the same time. For 3 years, 2021 to 2024, I lived in that chaos. Every day was the same cycle of grief and psychosis. I blamed myself for his death. I believed I could bring him back. I spent years in and out of the hospital.
Here's what changed everything. Getting on the right medication. When I finally got to the right antipsychotic in January of 2025, my delusions started to fade. I stopped believing I could resurrect him. My brain could finally grieve without the psychosis layer on top. And I realized something. I wasn't broken. My brain just needed chemical balance to process grief the way it was supposed to. Now, a year and a half later, I grieve differently. I celebrate his birthday. I celebrate the anniversary of his death. I make content honoring him. But I'm not stuck anymore. I'm not trying to resurrect him. I accepted that he's gone. And that acceptance came through medicine and time and finally having the right support.
What is happening in your brain? Schizoaffective disorder creates an imbalance in dopamine, the chemical that helps you think clearly and process emotions. When dopamine is out of balance, your brain creates false realities to make sense of overwhelming pain. The antipsychotic medication I take blocks excess dopamine, bringing it back into balance. When that happened, my brain could finally grieve normally. The sadness is still there, but the delusions are gone. I can think clearly. I can process the loss without my mind creating false hope of resurrection. That's the science. Chemical balance equals clear thinking. Clear thinking equals healthier grief. If you're grieving like I grieved, know this. Even though it feels like it's your fault, even though you replay the what-ifs, you probably couldn't have stopped it, and we couldn't change what happened. But we can change how we grieve. We can get help. We can heal. We can reach out, build a support system, get professional help if needed. There is a way through this.
If this video helped you feel less alone in your grief, please subscribe. Comment below. Share your story. Share who you lost. Share how you're coping. I read every comment. And share the video with someone who's grieving and needs to know they're not alone. If you need to talk, message me. Reach out to a grief group in your area. Call 988. You matter. Let's support each other through this.
This video shares my personal experiences with grief, suicidal loss, schizoaffective disorder, and mental health crisis. My healing came through medication, professional support, grief counseling, and grief groups. If you are grieving and struggling, please reach out for help. Call or text 988. Go to the nearest emergency room. Talk to a mental health professional. Join a grief group if you can. Your life matters. You do not have to go through this alone.